Hi, my name is Pietro. Did you know 1 in 14 men suffer from bowel cancer? I suffered from a rare form of bowel cancer that affects 1% of the population. Come and watch my story on Cancer Stories, please. Thank you. My name is Pietro Longo. I am the son of Janet and Gino Longo. I have one other sibling, and that is my younger brother, Domenico Longo. I've always been in fairly good health. I had hardly any time off sick off work. I was a fairly healthy person until April 2013, when I experienced stomach pains and I was diagnosed with Pseudomyxoma peritonei.
Pietro, thanks for coming in today and sharing your story with us on Cancer Stories. You actually have a very rare cancer, from what I understand. What's the name of it again?
Pseudomyxoma peritonei.
And what is that for people who are watching?
It is a cancer that actually comes from the appendix. It's, instead of an appendix bursting as in normal appendicitis, the appendix sprays a cancerous mucus all around your lower intestine, colon, etc. And this can cause problems, as it can sometimes go into it can affect the liver, spleen, gallbladder, etc. And it also has been known to cause pneumonia within certain patients. It is quite rare. In the United Kingdom, only 2 hospitals treat the condition. One is Manchester and the other one is Basingstoke. I went to the hospital in Basingstoke for this condition. It is treated by a technique called the sugar baker technique, which involves, they call debulking, which is removal of the affected areas covered in the mucus. And also within the operation, for an hour, they put chemo into your system. From what I understand, I had between 15 to 25 kilos of material removed during the operation.
Wow, that's quite a shock to hear that in a way. Quite a major procedure, obviously. Yeah. We'll come on to that in a second. First of all, tell us how all this began.
It began with feeling unwell over Easter last year. I had stomach pains, and because of stomach pains, because I couldn't find any way to sleep comfortably, I'd been to the doctors. They thought it was, firstly, they thought it was constipation, so I was given laxatives to treat the problem. Kept going backwards and forwards. They put me on the sick because I wasn't fit to go. They said fit to go to work. On my last visit, I had a temperature, so they told me they would call an ambulance and take me to hospital. I said, no, I'll drive home first and then I'll go to the hospital by car. I'll get mum and dad to take me.
How was the actual diagnosis made?
The diagnosis was made after the result of a CT scan. From what Mr. Thomas, the general, told me, when they got the results of the CT scan, they couldn't see a normal appendicitis. And so he wanted to wait to discuss it with the senior radiographer as to what it could be. And the next morning, after he'd seen it, they confirmed it was Pseudomyxoma peritonei, and that I couldn't be treated unless I would have to go to a specialist in this condition to be treated.
Did you know that surgery was planned at that stage?
Not at that stage, because I made a conscious effort, because of it being so rare, I made a conscious effort maybe not to read about it, because I always think that as human beings, we always look at the worst case scenario, and sometimes better off. Ignorance can be bliss sometimes.
Yes.
Especially when you're waiting for things to happen, because if you go it's going to make you more nervous when you actually go down and find out what could be going on. It might not be as bad as you think.
So you were kind of avoiding looking up too much information too soon?
Yes.
What did they tell you was the next step when it came to that?
When I went, I had an appointment. I got a letter through from Basingstoke to come down and see them in May. We went down and saw them in May. I had an examination and a CT scan at Basingstoke. I went down with my mother and father and a family friend who drove us down, and they said, we'll let you know as to when you'll be coming back for your treatment. And I was in at the beginning of June. I went in on Sunday, June the 2nd, and the operation was on the Tuesday, June the 4th.
Okay. What did the procedure involve?
The first part of the procedure actually starts the night before, where you're given strong medication to make sure that your system is completely empty. The procedure started at 7 o'clock in the morning, and the procedure results, they call it debulking, which is the removal of any infected areas. As I said before, they also insert a chemo, and I ended up with a temporary stoma for about 9 months, which is a bit hard, to get used to. It's not something I was actually prepared for, because at one point I was told I wasn't likely to get it, but obviously as a result, being more problems were discovered in the surgery that couldn't be seen on the CT scan, I ended up with a temporary stoma.
So the stoma was there for how long for you?
It was there till about May this year.
Okay. Now, a lot of people watching, when they have a bowel cancer, they're afraid of the idea of having a stoma. It's an unfamiliar thing. It's something that, most people are not comfortable with, let's put it that way. But how did you find it once you had the procedure? Did you get help to manage it? Did you have stoma nurses? Or?
We had stoma nurses, and it is a hell of a shock. Yeah. Especially when you're not prepared, because until really they went and did the surgery, you can't see everything on the CT scan. So they did these, like I say, and to be honest with you, even up till almost before I had it reversed, it still was, does knock your confidence if you're not a very confident person.
Of course.
Because you're always worried about what can happen if you go out. You're always self-conscious, and it is always in the back of your mind.
Yeah. One of the worries is that the stoma might leak, or it might become detached. In reality, is that a real risk? Does it happen?
I only have happened maybe twice in the 9 months, and most of that time when I was in bed. Twice it happened, but other than that, no.
It never happened when you were out?
No.
Okay. And did your confidence improve then when you were gradually venturing out with it over time? It
did, but it was still something that you automatically just kept on checking.
Yeah.
Just by touching, just making sure everything was all right. I was still aware of it.
Yeah.
It wasn't like it had become a natural part. It was still something completely different. I suppose the longer period of time you would get more used to it, but I think it depends on each individual is going to deal with it differently.
Yes. Did it restrict what you could or couldn't do?
Well, if it does restrict your diet, there are certain things you can't eat. You can't eat fibrous food, pork you can't eat, anything with fruit, nuts in you can't eat, because it can actually block the stoma.
Really? So anything that's kind of hard to digest with this.
So you can imagine, let's say,
slow transit time.
For example, if you like Christmas pudding, that would be on the list that you can't eat. You've got to be very careful, and then you have to eat certain things to thicken up the discharge from the stoma.
Yeah.
Which meant I had to eat jellied sweets such as wine gums, which I do not like, but you have to eat them as part of the thing to help.
Interesting. What about those classically unhealthy things like dairy produce or high sugar content food, sweets, that kind of thing?
Certain sweets, if they've got nuts in, or fruit, you know, raisins, you just tend to stay away from.
Yeah.
Popcorn, no. There are so many things. It's a case of just being aware and just checking what's in certain foods, as if you would do with any food condition.
And do they give you that list, or do you find out the hard way?
They do tend to prepare you as to what you can and cannot eat.
Yeah.
Because I don't think they'd send you out and say, go in and eat, find out for yourself. But I think a lot of it is because of the aperture it's going to be coming out of is not as big as the normal discharge system.
Yeah, I understand. Eventually, you had the stoma reversed. Yeah. I'm sure that was a relief for you. What was it like having that reversal and then going back to the normal system, as it were?
Well, the first thing is you have to have a test before you get the reversal. So really, you go down. I went down on the funny thing. I'd actually agreed to go back to work with the stoma in a meeting on one. I went into in May, and I had a phone call in the afternoon. I'd just come back from the meeting that said, "Could you come in next Thursday for the test, and your operation will be on the Friday?" I started to feel I can't come back on the agreed date as I'm going back into hospital. The first thing is you wait for the results of the test. Until you get the results of the test that you can actually have it, you still are not confident until you get, you know, like anything, until something's signed on the dotted line, you've got the proof and you think, yes. And then I went in on the Friday for the surgery. And as far as I'm aware, the first thing I did when I was told, my mum told me it's gone, was to just lift up and just check it had actually gone. Lift up the sheets and just check it wasn't. I don't remember that because I think I was still a bit coming out of the anaesthetic. But I think that's a human reaction that we'd all just double checking, yes, it has gone.
Yeah, absolutely. So after that kind of gap, you had the reversal, and then did life kind of start to get back to normal?
Yeah, because I was in hospital for 5 days, and then you come out, but your wound still needed dressing every day at that point. Yeah. And then it decreases to every other day. Okay. And then luckily, just before I had agreed to go back work again, when I saw the district nurses, they said, no, you don't need to put anything on it now. Right. Leave it alone. You can go back work without having to come in to have dressing put on it. And
just for the viewers' benefit, you mentioned this test that you had to have the night before, but what was that test?
It's an enema-based test. Okay. Which which is not very pleasant. No.
You're checking the bowel is working again?
They were checking the bowel's working, and also that there's no damage in the bowels and or blockages caused by the surgery. Yeah. Because also you can have, as a result of that, is scar tissue within, just making sure everything flowed through.
After the surgery, I think you had to have more treatment, and that was chemotherapy?
Yes, it was chemotherapy. It was a 2-drug chemotherapy that had every fortnight for 6 months. And
how did your body tolerate that?
I think fairly well, according to what they said. The white cell count was always quite good. I only had 1 delayed treatment, and partly was that so I could go to the dentist, because when you're on chemotherapy you can't go to the dentist because the jelly sweets that I'd been advised to eat had actually cracked a tooth, so I had to have they allowed me to have a week off to get the filling, get it done.
Because not everyone completes their entire course of chemotherapy, but in your case you did accept 1 treatment, have the whole lot.
I had the 1 delayed treatment, which I did have. I actually completed the whole course. I went all the way through. Yeah. The only thing they had to do was to change the strength from one of the drugs, because for the tolerance, because of I was doing quite well, I believe, so they lessened it down. I had a pump on my arm after the chemotherapy in Leicester that was on my arm, giving chemotherapy for 48 hours after that, which I used to come home with a tubular pump about the size of a small jam jar in a tubular bandage, and that was on from Friday to Monday when it was taken off by district nurses.
That must have been a little bit of a shock to have that.
Yes, a shock, not very comfortable, because it's on perfectly all the time. If it's warm, because you've got the bandage on, it will make that sweat. It's a bit of a shock. It takes a lot of time to get used to, because it's not something. In the end, when I was sleeping, I used to put a pillow on that arm, just cover it up, just so it was easy to sleep.
Did it alter your participation in anything? Did
Yes.
you have to be cautious about something?
I think it was more that you had to be very careful who you're around. I was told that not to go anywhere where there was lots of people, to restaurants, cinemas, even shopping. Go when it was going to be less busy.
You had to be a bit more cautious.
Yeah, yes, because of catching infections, etc.
And I think you told me the chemotherapy went on for about 6 months, the entire course.
Yes.
Any particular complications over that time?
Only I was on a drug for depression that had to be changed because with the results of chemo, it was giving me slight shakes in the hand.
Yeah.
And I had to change from that, and that's the only thing I had to change.
So overall, it sounded like you tolerated the chemotherapy quite well. Really.
Yeah. Luckily, the only other thing I had to do was cut down on the amount of steroids they were giving me. They normally give you 2 tablets of steroids. They had to just cut down because it gave me too much of an appetite.
Yeah.
Whereas I believe a lot of people struggle to eat when they're on chemotherapy, and that they had to rein me in because I was eating too much because of the steroids I was on.
Interesting. Any other side effects from the steroids?
Just not really, no. The only other side effect I had was just tiredness, because it takes a lot out of you. Even though you just think you're just taking the drug, it does seem to be physically draining.
Let's talk about fatigue, if you don't mind, for a few minutes, because that's a very commonly reported adverse effect. Sometimes not clear, is it due to the disease, is it due to the chemotherapy, or sometimes due to stress, depression, anxiety?
I think it's a combination of all of them. I think because the chemotherapy tends to be, it's quite an aggressive treatment, that will always have an effect on your body's functions. Plus you are, and I was depressed, that also can cause fatigue.
Yeah.
And then I think it's the same, because you've gone through major surgery, then you've gone into another form of treatment. Your body is going to say it's going to need a lot of time to recover, and even it's not as if you're going to be 2-3 weeks. It's an ongoing monthly thing for even months after you finish the treatment. Your body is still healing itself. You cannot expect to rush straight back.
How severe was the fatigue in your case?
Well, I just used to fall asleep on a sofa, in the middle of the afternoon, just completely go for 3 couple of hours. But as we were discussing, Mum and Dad said, that's your body's way of telling you it needs you to shut down. It needs you to just rest while it does its thing inside to heal itself, because it just let it go. Don't fight the fatigue. Yeah. If you're going to have a nap, have a nap.
So that's an interesting way of looking at it. You almost think of it as part of the healing process.
Yeah, because your body, that's a signal from your body. If your body's telling you you need to sleep, don't fight it. That's your body saying, I want to rest.
Yeah.
Don't try and force yourself. Don't try and do too much, because in the end, you could do more damage. Listen to your body sometimes.
Now, one type of fatigue is where you feel tired, like you want to sleep.
Yeah.
Another type is where you feel physically drained, like you've exercised, your muscles may be aching, or you just can't face continuing with an activity. Which for you was it?
Mine, it was the falling asleep, because I tried to at least get a walk for a couple of miles a day, but at a slow pace, which was quite good until, say, somebody else was with me and I had to try and catch them up, because certain members of the family, being my younger brother, tends to walk very quickly, and he was not compensating for me, so I had to keep saying, could you slow down please? But he gradually slowed down, and then realised that I was struggling, and he would break his speed down.
Did he used to help you to have that regular walk?
It did, because I used to try and walk every morning, just especially when I hadn't got the pump on, just to get out, because you can become too internal. You're not getting out, and you don't really want to be sitting inside all day, because in the end, if you get out, and you see other people, or you get out, it's a distraction. Definitely. It takes your mind off what you're going through.
I can definitely see that. Sometimes it's hard to motivate yourself individually when you're on your own.
Yeah.
But I think you just said there you had your brother. So is it a tip for others to actually go out with somebody else?
I think it's got also, in fact, there's somebody there if anything's, but also it's a social interaction, because I found you can become very insular. You become withdrawn and into yourself. Whereas if there's somebody there to talk to, I was lucky. I had my family. I went to stay with mum and dad while I was in treatment. My brother, because we live in the same village, he was, he used to come around every day after work. It's just so you're always interacting, and it's good because they're looking after you, but they can see any progress that you're making, and also you need to talk to people. You cannot do it on your own by not talking. That's why, because I started off not talking, and when I opened up, things I found came easier.
How do you break down that barrier to feel comfortable talking about your condition?
Well, to be honest with you, you don't know when, and sometimes it just happens, and sometimes you realise that you can't deal with it on your own. As a race, we're a social race. We always talk to people, whereas we're not designed to live on our own. We need interaction. We need to talk, and as they always say, a problem shared is a problem halved.
Were you ever worried or embarrassed talking about your condition, your cancer?
No, because it was part of what I was dealing with. It was part of me. You can't hide away from it. It's not as if you can put it into another room.
Yeah.
It's part of you. You've got to deal with it. And when people used to come around, they knew I was so, and they used to ask, I used to tell them. I used to be up front and tell them, because there's nothing to be embarrassed about. You've just got, it's part of you, and you're going through a treatment to deal with it. That's
very admirable, because other people feel they can't talk about it and they're ashamed of cancer. Even nowadays it happens. It's surprising, but you were prepared to talk about it and you weren't embarrassed about it.
No, because what's it been about? It's an illness. It's the same as if you got cold, flu. It's an illness. It's just one that has a stigma attached, which is wrongly attached, because anybody can get it. It can be dealt with. The treatments are getting better, and it's a case of what's it being embarrassed about.
Absolutely. I'm interested to hear how long it took till you started to feel back to your normal self, and what you started to do. In the sequence of events, you'd had the surgery, you'd had the chemotherapy, then you had the reversal, the second procedure to reverse the stoma. So after that, how long till you started to feel back to your normal self?
Well, to be honest with you, after I'd had the surgery, and it just waited things to normalise within that region, it wasn't that long. Slowly I started to feel back to normal. I mean, even now, I know I'm not completely back to the way I was before everything started, but I know I'm getting there. I can see there's a light at the end of the tunnel. I mean, within about 6 weeks after surgery, I'd actually gone back to work part-time on what they call phased return, where you do so many hours a day for so many days, gradually building up to going back full-time.
And where were you working at the time?
Well, I work at Europcar Group UK in Leicester, on the head office is on Welford Road, and I run a department within that company. Yes,
it's a rental car company, isn't it? And how were they as an employer?
They were very good, actually. Very supportive. I mean, my manager came to see me a couple of times. We kept in regular contact by phone, by email, etc.
When you went back to work, were you ready to go back? Were you keen to go back, or were you nervous about it?
I was nervous, but I was keen to get back, because by going back, it was a sign that things had started to get back to what you call normal. And it was a case, also the fact is, when you're at work, you've got things to do, and you're not sitting there pondering, you know, what could happen.
Yeah.
You've got an interaction with people that you've known for, say, 10 or more years.
Yeah.
So therefore, it's better. It takes your mind off it, because you've got different things to concentrate on. You've got work issues to concentrate on rather than health issues.
Exactly. So you've got your role back, and you got those contacts back, and presumably it gave you routine as well in terms of the days.
Yeah, because especially once you've gone back to going back to your normal hours, you know what you're doing between, say, in my case, between 8 and 4:15. I know what I'm doing. I know I'm doing my job.
Was it helpful to get that routine?
Yes, because it's what the routine was before.
Yeah.
It's a good thing to get back to it, and also you are making progress. Once you've got over that, you can see that you have made progress from what I was at this time where I was at state this time last year, whereas this year, I can see I've made progress.
How long were you off work altogether?
14 months.
It's quite a long time.
Yes.
If you look back on that, do you feel that after that really long gap, you were able to get back to work in a quite straightforward way? In other words, despite that long gap, you really, with that phased return, were able to return to your normal role without too much of a struggle?
Yes, because luckily I was able to, because most of the procedures that had been set in place within my department, I'd actually set it, and none of those had changed.
I see. And
I knew what my role was within. I run the team. I do a lot to do with the billings, the payment of the bills, etc.
Yeah.
It was my role hadn't changed. It was passed to other people who were gladly passed it back because they did.
They were glad that they could give you the work back to do.
Yes, because especially because it had fallen really on one person. She was quite happy that I was back to take it back.
I understand. Yeah. So the job hadn't changed. Somebody else was doing it, but they were glad that you were back. Yeah, I can see that. How was your family or home life affected?
In a way, it sounds strange, but it's actually brought me closer to my family. Because I spent more time since I've been a child with my mum and dad. I think it's brought me closer to my brother. Even though you are still your family, because you've shared something so traumatic, I think it does bring you closer. And also, I think it gives you a better understanding how much you could say you're loved by your family. And I think we're now probably a stronger family than we were before.
How much were they involved with your care?
Well, I went to stay with my mum and dad, so they were really my carers. They were there they were there almost 24 hours every day.
How did you find that period, that extended period where you'd move back in with your parents?
But the first thing I felt was guilt about having to put them through it. Especially because you do feel guilty, because you do feel like you put it upon them, and then you realise that they wouldn't want it any other way. And if it was a system reverse, I would want them. I would do exactly the same, because it's that thing, because it's your family and you love them, and nothing's too great, for you to do for your family.
I can understand that. Was anybody else involved in your extended circle?
Friends did come and see me. Some relatives did come and see me. We had phone calls from Italy asking how I was. So yeah, I did keep, and some people I kept in contact by email because they'd emigrated to America. So
overall, what would you say their reaction was? How did they cope with the idea you were unwell?
I think mostly at the start, it was shock. because I'd never actually been ill. It's a shock when the person who, out of the family, had never actually been ill, never been on prescription tablets or anything, was suddenly now the one that was ill. I suppose it's more of a shock. And I suppose looking at it from a parent's point of view, it's also because it's your child. Even though I am what the age I am, to them I'm still their child. And there's that thing, they always say no parent wants to see their child ill.
Did the clinical nurse specialists or other healthcare professionals play an extended role after you were going into the rehabilitation and recovery period?
Well, I did see Macmillan nurses, and I did see a nurse specialist in psycho-oncology, because I was diagnosed with reactive depression to the situation rather than normal depression, which I suppose is fairly understandable because most people are going to feel down, miserable. But and I almost saw the same district nurse fairly regularly, and that was quite helpful. When you see a familiar face, it's always quite helpful within that.
Let's talk about the depression a little bit, because a lot of viewers struggle with the emotional complications of cancer, but it may or may not be recognised for them. How did you notice that your mood was not quite right?
Because I felt a great deal of guilt of what I was doing to everybody else. For me, I felt guilt of what I was putting everybody else through. I think my mood was miserable from what I believe people used to say. I didn't seem to be chirpy or happy. I was quite insular, non-communicative, and I presumed that that's what it was, and they got in contact with Macmillan's through the doctors, my doctors, and I was diagnosed with reactive depression.
Depression can affect people in different ways. What were the main symptoms for you?
I think it was more that I was insular and not very communicative, and also partly you could also say the fatigue could be part of that as well, because that is part of, you can become very tired when you're suffering from depression.
Had you lost interest in doing things? Or?
I found it very hard to read books. My attention span wasn't great because you can't really concentrate on anything.
Any physical symptoms in the body? The fatigue you mentioned, sleep problems as well? Yes,
I was having trouble sleeping, falling asleep, because it used to take me a couple of hours of lying there. And then when you're lying there, that's when you'd get all your miserable thoughts. When it's 2-3 o'clock in the morning, you're still not falling asleep. That's when you tend to be very miserable.
Sometimes if you have time on your hands, that's when those negative thoughts will go through your mind.
Yeah, because that's it. I always find that time of morning, or when you say you've got too much time, that's when you start to think about the worst case scenario. Whereas if you've got something to do, you're not thinking about it, you're concentrating on anything other than silly, stupid thoughts about what's worst that can happen, when really you should be saying, let's just take one day as it comes, take that day, deal with that day, and don't try and look 4 or 5 months ahead, because there's nothing you can do about it. You just got to live for the day.
What were those negative thoughts, if you don't mind saying, going through your mind about what might happen?
Well, I suppose one of them is that would it be better for everybody if you didn't wake up the next morning? Just not wake up.
Is that because you'd felt at that time a burden to others, or was it too hard to face what might happen?
I think it was more that I felt a burden, and I could see what I was putting everybody else through, and I think it's the guilt of what you're putting everybody else through.
So at times you thought, it would be better if I wasn't around.
Yeah. Which I did tell them that, and they said, stop being stupid. You're not a burden.
It's good, it's appropriate to seek out that reassurance, and they told you that's not the case, so that's important. In addition to that, were you worrying about the prospect of a complication coming along or the cancer progressing in the future?
You are always going to worry about that. But as I say, I trusted what was being done. You know, and you think, well, they've had a scan, they had one scan before you started, so they know what they're dealing with. Then you think they're monitoring you all the way through, they're taking your bloods, and if there was a problem, they'd be able to see by what was happening. And that, you've got to trust, because if you don't trust, it's going to affect the way you are, which in the end will make you more miserable. But also, if you don't trust, how are you going to get things to work? You've got to work with what you're going on with.
Yeah.
Otherwise, how are you going to progress? Because if you're continuously going to try and fight your treatment, it's not going to do you much good.
Did your view of the future change in the sense that you regained some, one, feeling that life's worth living, and two, hope for the future, that you've got things to look forward to as well? Yeah.
My aim was always to go back to work. My aim was, once I got back to work, I knew that I was getting on a road to recovery. My recovery was ongoing, but was getting there.
Yeah. Because
that's the goal I set myself. I wanted to get back to work. Because I didn't want to be sitting around. I wanted to get back to work, just to give me that normal, being back to normal. And once I got that, then you feel that you are back to normal, because you're back to your everyday routine. Before the treatment, before the diagnosis, you're back to where you were.
So for you, that the fact that you were trying to get back to work and then achieved it, kind of reinforced to you that things were going well.
Yeah.
Did you have any other targets or goals?
Well, one was to go away, which I did. I went to Whitby for a week. It was just to get back, and also to move, because I was at Mum and Dad's. I also wanted to get back to my home. I wanted to get out from under their feet and get back to my home. And
what happened in that regard?
Well, the week I was due to start back, they booked a holiday to go away, so I moved back anyway. They booked it, and then they realised that for a couple of days before they're going away, I was starting back work on a phased return, and then it's, I moved. So in the space of a week, I'd started back work and moved back into my own house at the same time.
How did it feel being back at home?
Weird to start off with, because for 14 months I'd lived somewhere completely different. But it's your house. It's like anything, isn't it? It's your things, it's your house. Even though you can take so many of your things there, it's not your house. It's completely different.
Did you feel vulnerable though, being on your own again?
Well, luckily no, because I share a house with my brother, so I'd got somebody there. I'd got somebody to talk to. Somebody had seen me through what I'd been through. There was somebody there if there's any problems. And it helps when you've got somebody to talk to.
Definitely. So you weren't really on your own at all.
No.
You had your brother there, which counted for a lot.
It does, because we've always been able to talk. If he's got problems, he'll talk to me, and vice versa. And he knows what I've been through, and he also, was there to keep an eye on me, make sure I was all right.
Yeah. What do you see in the future for yourself now?
Well, I just try and take every day as it comes. I know I've got another blood test in November, another appointment to see the oncologist, and I take it from there onwards. Take it that one bit at a time. Just little targets. Don't set big targets. Set little targets. Take it as it comes. And also, I think it's now made me more laid back. I see, because from what I understand, my personality, I'm more laid back. Just take it as it comes. Come less stressed, because you realise there are bigger things that you can't control, and I couldn't control what happens to me. You can't control it.
Do you believe something good can come out of a negative experience, like a diagnosis like that you've been through?
I think so, because you learn something about yourself, how you can deal with these things. But also the fact is, you can bring you closer to people. You can bring you closer to your family. And maybe it makes you look at things that what you thought were big things before are not worth worrying about. There's other things that are worse. And maybe that's the thing, we don't realise until you're in a situation that something trivial that we tend to blow up out of all proportion isn't worth blowing it out of proportion. Whereas if you, things like the diagnosis, that's something that is big, whereas little things are not worth worrying about.
Pietro, I think that's a very good way of looking at life, and I appreciate you giving those tips to the viewers and myself as well. So thanks for coming in today and sharing your story. You've got a very unusual cancer and people will be fascinated by it, but still there's a lot of common threads in what you say, and I'm really inspired to hear how you've battled through it. You've got back to work, your attitude is very positive, and you've got a very healthy way of dealing with it. So thanks for coming in again, and all the best for the future.
Cheers, thank you very much.